to the organizer of the World Congress on Heart and Cardiovascular Disease. It has been an honor to be a part of this esteemed event and represent Bangladesh. Gratitude to all the participants for their valuable contribution towards advancing cardiovascular healthcare. It's me, Dr. M.D. Abir Tazim Chowdhury, specialist cardiovascular and thoracic surgeon from Evercare Hospital, Dhaka, Bangladesh. Meet my mentors. These are the two mentors under whom I am working, Dr. Shoal Ahmed and Dr. Zulfikar Haidar. The topic that I'm going to present is impact of COVID-19 on congenital heart surgeries and their early outcomes, a single center experience in Bangladesh. This is the hospital where I am currently working, and this is the center where the current study was conducted. Before proceeding to my presentation, please allow me to begin by expressing my heartfelt salute and sharing a powerful sentiment to our COVID healthcare fighters. Amidst the chaos, healthcare workers stood as beacons of empathy. Their steadfast commitment reminding us that the power of healing lay not only in medicine, but also in the unwavering human connection they forged. The trends of COVID-19 pandemic in Bangladesh. The COVID-19 outbreak that began in China in December 2019 quickly spread worldwide. On March 8, 2020, the Bangladesh reported its first 3 confirmed cases of COVID-19. The image shows the trends of COVID-19 case, and currently there are 20,38,384 confirmed cases of COVID-19 with 29,446 demise. What the impact of COVID-19 pandemic to the cardiac patient in Bangladesh, how it affects. Pandemic had a significant impact on cardiac patient in Bangladesh, just as it did in many other countries around the world. The pandemic affected cardiac patients in several ways. Delays in treatment, lockdown and movement of restriction during the pandemic in Bangladesh caused treatment delays for cardiac patients as hospital and clinics become less accessible. Change healthcare delivery. The pandemic led to change in healthcare delivery, with many hospitals and clinics struggling to cope with the influx of COVID-19 patients, resulting shifted healthcare resources. Increased risk of infection. Cardiac patients, being more vulnerable to COVID-19, had to take extra precaution due to their increased risk of severe symptom and hospitalization. Importance of prioritizing the cardiac care. What happened to the pediatric cardiac patients? There was fear of uncertainty because disruption in regular pediatric cardiac care due to the reorganization of the care system focusing COVID patient. It reduced the specialized pediatric care. Challenges in accessing specialized care and telemedicine. These groups of patients need specialized and often multidisciplinary care, but it faced challenges on in-person visits and travel restriction. However, comprehensive cardiac evaluation hampered in virtual consultation. Psychological and emotional impact on pediatric patients and families. The fear and uncertainty surrounding COVID-19, coupled with the disruption in their medical care, can lead to increased anxiety and stress among these young patients. Additionally, restriction on social interaction, school closure, and limited access to support network can contribute negative impact on their mental well-being. What impacts on cardiac surgical patient care? The effect was felt by medical professionals and those seeking care. It had negative impact. It reduced number of outpatient visits, reduced number of hospitalization, and reduced number of dedicated staff and surgeries. In a global study encompassing 52 countries and 176 hospitals, it was found that in almost half of the program, that is 46%, about an 81 center, the availability of operating room and ICU bed was reduced due to the needs of patients with COVID-19. Additionally, in 88% of hospitals, all elective pediatric and congenital heart operations were postponed. In India, the pediatric cardiac center outpatient visits decreased by 74.5% in 2020 compared to 2019. With reduction in hospitalizations, surgeries, and procedure, in-hospital mortality rates were higher in 2020, 28.1% than in 2019, that is 4.8%, including higher post-operative mortality 9.1% versus 4.3%. However, to best of our knowledge, there is no published data from Bangladesh. The purpose of this report is to analyze the effect of the pandemic on the clinical practice of congenital heart surgery in a single center. Given this context, our research aim was to establish, and it was to investigate the impact of COVID-19 on congenital heart surgeries and their early outcomes. This study was approved by the concerned departmental academic and technical committee. It was a retrospective study conducted at the Department of Cardiothoracic and Vascular Surgery between December 2022 to January 2020. We enrolled 125 congenital cases and analyzed the early outcomes and also overview the impact of COVID-19 pandemic. The patients selected for the study were those who had undergone surgical correction for congenital heart disease. This is for individuals of both pediatric and adult age group who have scheduled the congenital heart surgeries. Number of patients visited in our outpatient department in pre and COVID-19 pandemic era. During the COVID-19 pandemic era, the number of patients visiting our outpatient department showed a significant reduction over a 3 years period. In 2020, there were 704 visits compared to the 2,797 and 2,546 visits in 2022 and 2021. Respectively. In the pre-COVID era, 2009 to 2017, the patient visits were higher with 2,645 patients to 2,832 and 2,942 visits respectively. So it indicates that outpatient visit reduction noted about 20 to 30% in 2020 comparison to the others years. Average costing in hospital stay per day without adding surgical and post-surgical care cost. Pre-COVID era, it was low, $80 to $120 per day. However, in COVID era, it was too much high, increasing health. It's because of increasing healthcare demand, higher prices of personal protective equipment, cost of diagnostic testing and procedures, postpone of surgeries due to the COVID positive diagnosis, supply chain disruption and expenses related treatment and research. It is about double of pre-COVID era. Surgical and post-surgical care costing in COVID era. Financial impact was really worse. During the COVID-19 pandemic era, the cost of surgical and post-surgical care experienced a significant increase. This can be attributed to the scarcity of surgical equipment in the local market and the challenges and high cost associated with importing equipment from the abroad due to the restriction. In ICU, in pre-COVID era, the ICU stay in our hospital was $150 to $180 per day. However, in the COVID era, it almost doubled to $200 to $250 in ICU stay per day. And surgical costing also rise to 10 to 15% due to the point that I mentioned. What's the impact on healthcare team? It's also a negative. In the first year, 85% of the departmental staff tested positive for the infection at various intervals. Our infection control team promptly traced the source of contact, identified and tested all the exposed individuals and provided quarantine and isolation support. However, this had negative effects, as I mentioned, including the reduced manpower, increased healthcare expenses for the staff and their families, and the occupancy of hospital beds for isolation and treatment, and significant impact on the mental health of the staff due to the uncertainty surrounding the COVID-19 virus. This slide is about the timeline of surgeries performed in pre and COVID era. The slide shows the frequency of congenital cases per years also. In typical year, we perform 350 to 400 cardiac surgical cases with approximately 10% being congenital heart surgeries. However, in 2022, there was a reduction in surgical intervention due to the impact of COVID pandemic. Due to border closure and restricted routine cardiac services in our country, there was limited reduction in cases at our center, particularly for the affluent patients who typically sought medical services and congenital heart care abroad, notably in neighboring country, our friendly country, India. This is about the time, as I already mentioned, the timeline of surgeries performed in pre-COVID and COVID era. It's the in pre-COVID era, about 1,122 total surgery was performed in our center, and among them, 118 congenital cases were performed. However, in the COVID era, we performed 1,060 cases. Among them, 125 congenital cases were performed. How we deal with patient during the COVID pandemic era. Preoperative screening and testing. Hospital implemented rigorous preoperative screening protocols, including the COVID-19 testing to identify the positive patient and minimize the transmission risk in the surgical settings. Enhanced infection control measures. We implanted the strict infection control measure, including the PPE uses, hand hygiene protocols, and equipment disinfection to minimize the COVID-19 transmission risk. Patient prioritization and case triaging. We implemented the case triaging protocols to prioritize urgent and high-risk cardiac surgical procedures, optimizing resources utilization and minimizing the COVID-19 transmission risk. Post-operative monitoring and follow-up. We implemented the post-operative monitoring and follow-up strategies, including the remote telehealth consultation to minimize hospital visit and reduce the COVID-19 exposure risk while ensuring the comprehensive patient care. This is the slide about the age and gender distribution in current study. Out of 125 cases, adult male were 26 cases, adult female were 18 cases, pediatric female were 30 cases, and pediatric male gender were 51 cases. The mean age at the time of the cardiac surgery was 11.9, and lowest age was 1, and the highest age was 51 years. This is the slide about the congenital cardiac lesion operated in COVID pandemic era. As I mentioned, our sample was 125. However, the total number of cardiac lesions we found is 143. Some cases in the study, population had combination of the cardiac lesion, and we found the 4 syndromes, that is about 3.2% in our current study. 2 cases are Down syndrome, 1 cases are Turner syndrome, 1 cases is Klinefelter syndrome. Out of 125 patients who had admitted for congenital heart defect surgery, a total of 143 defects were, I as mentioned, defect we found. The most common defect was ASD, accounting 57%, followed by the BSD at 21%, pathology of fallout at 10%. Other less common defects include PDA, BSD with aortic insufficiency, BSD with PS, partial avicanal defect, partial anomaly of pulmonary venous connection with ASD, and Epstein anomaly, and others. This is the slide about the congenital heart surgery in COVID era we performed. Distribution according to the correction types. Among 125 cases of congenital cardiac surgery, ASD repair was the most frequent procedure, that is 57%. BSD repair followed at 21%, while the TOF complete repair was performed in 10% cases. Other procedures which include the PDL ligation, BSD and BSD with aortic valve repair and replacement, partial AV canal repair, partial anomaly of pulmonary venous connection with ASD repair, and shunt surgeries accounted for smaller percentage. Operative and post-operative variable that impact on outcomes are use of cardiopulmonary bypass. Out of 125 cases, we use cardiopulmonary bypass in 118 cases as an open heart surgery. However, in those cases, the cardiopulmonary bypass time was median 123. Minimal of them is 41 and maximal is 245. Aortic cross clamp type was 86.5. Median, minimal was 21 and maximal was 185. ICU stay, median stay is 3 days, minimal was 1 day and maximal was 12. Use of ventilation more than 7 days is found in 1 cases. Hospital stay more than 14 days was found in 3 cases. This is the slide about our post-surgical complication. As in this study, with a sample size of 125 patients, the finding revealed that 2.4% has experienced death within 30 days, while the 25.6% had complication related to arrhythmia, with atrial fibrillation being the most common one at 16.8%. Other notable complications include low cardiac output, that is 6.4%, pleural effusion 6.4% also, and the heart failure is 3.2%. As I already mentioned, the post-operative arrhythmia was the one of the most common complication, and the atrial fibrillation is most frequent one. Demise, always a painful end. We found 3 cases of unfortunately demise in our study, and each demise life leaves behind a void that echoes with the grief and compassion of both the family and the dedicated healthcare professional who work alongside them. The number 1 case is the TOF experiencing with multiple set spills. The patient who were 1 year, 10-month-old patient with a preoperative diagnosis that I mentioned. The surgical procedure was performed the complete correction of TOF, but cause of death was multi-organ failure. In case of number 2 case, a 7 years 2-month-old patient diagnosed with a double outlet right ventricle with pulmonary stenosis underwent complete correction surgery but succumbed to multi-organ failure. Case 3 features a 1 year 10-month-old patient diagnosed with a tetralogy of Fallot with hypoplastic pulmonary artery. The surgical intervention was a central shunt, but the cause of death was also multi-organ failure. It's our overall outcome. Follow-up period of each patient were more than equal 6 months. 125 patients were admitted in our hospital. Among them, 143 defects were identified, and we are fortunate that 15 post-COVID patients who recovered well from this COVID status also underwent these surgeries. Male were 56, female were 68. Pediatric case were 81 and adult case were 44 congenital cardiac surgery. Out of 125, 122 patients were discharged to home uneventfully and with a well recovery. However, the 3 unfortunately demise. That is our scenario. Summary of the study and our assessment. We assess the outcome. This study assesses the outcome and complication of congenital cardiac surgery at Evercare Hospital, Dhaka, Bangladesh. The most patient had a cyanotic congenital heart disease. The mortality rate of 2.4% was encouraging compared to the other developing countries. Assess the impact of COVID-19. Despite of the COVID-19 pandemic, the number of the surgeries, including the congenital cardiac surgeries, remained relatively unchanged. However, it imposed financial burdens on patients and reduced dedicated manpower due to the isolation, quarantine, and hospitalization of staff exposed to or infected by COVID-19. Our recommendation, what we are planning, what we are try to tell you that the study is conducted in a small population during the COVID pandemic era. But our recommendation is conduct larger scale studies to gather a more representative population. Need to collaborate with multiple centers for a broader perspective, include long-term follow-up to assess the early outcomes over an extended period, conduct comprehensive analysis between the pre-pandemic and pandemic periods, evaluate the effectiveness of mitigation measures, and ensure the patient and family support. It was our journey, not the story of success. I would like to put a quotation that is, the success is not merely the achievement of a goal. It is the culmination of the journey, the growth, and the lesson learned along the way. Despite the pandemic challenges, our team successfully continued the cardiac surgical care, combating the COVID-19. We adapted and overcome the obstacle to ensure the seamless delivery of cardiac surgeries during the pandemic. Our collective efforts enable the uninterrupted access to life-saving cardiac surgeries for patients. Through collaboration and resilience, we prioritize safety while providing high-quality care. Our success amidst COVID-19 showcase our commitment to the patient care and ability to thrive. This is the road of COVID-19 era. We are the generation of witness. Since the social outbreak of COVID-19 pandemic in December 2019, we passed a significant flag mark by the WHO on May 4th, 2023, declaring that it no longer of international concern, signifying a remarkable milestone in our collective efforts to combat this virus. Thank you all for patience hearing.
Thank you, Doctor, for that